Okay, healthcare. As a clinical psychologist, healthcare is near and dear to my heart. As a consultant, I've spent years consulting with hospital CEOs and senior teams. Here's the thing about healthcare, Marjana. People within healthcare, most of us think and act like our jobs are life or death. If you're in healthcare, your job likely is, particularly if you work in a hospital. I think about myself more. If I have a bad day at work, okay, maybe a client wasn't particularly thrilled with the speech and, oh, I hate that. And I will try to do everything I can to avoid that, but no one's going to die. If I'm a surgeon, if I'm a nurse, and I make a big mistake, somebody could die. So you get that stress right at the top. Number two, we haven't been able to figure out healthcare within the United States anyhow. If you're working in healthcare in the United States, our systems are changing how we deliver healthcare. I remember I was giving a talk for a large healthcare system, and the CEO of the system got up there and he said, folks, all the ways that we make money today in our healthcare system are not going to exist 10 years from now. So we got to shift. And of course, it's then within healthcare, you folks know that it's making that shift from putting people into the hospital, getting them feel better and sending them home, to keeping them out of the hospital in the first place, and value-based care and all those sorts of things. But there's no blueprint. There's no like, oh, let me go read the manual. Let me see how we did this last time. And then you throw on top all the political stuff and the governmental stuff about trying to figure out, how payment systems are going to work. So if you're in healthcare, you mentioned, Marjana, you mentioned self-care. Burnout. I don't need to tell you if you're in healthcare. I spoke to another large healthcare systems not so long ago, and I was looking up some of the research, and half of the doctors and nurses report that they're just feeling burnout. They're kind of lost. And it's hard, but you got to find some way to refuel yourself. Now, luckily, there are tools. In my field, psychology, positive psychology, we got a lot of tools that we use to build well-being, to build happiness, even when we're working in incredibly stressful environments. If we're a leader within healthcare, we have an added responsibility to, of course, start off taking care of ourselves, but to make sure we are delivering high quality healthcare. But man, you got to love on your people. You got to love on those department heads. You got to love, and you got to, another thing in healthcare, we got medicine and we got administration, and never the two shall meet most of the time. It's a natural built-in tension. Medicine is over there, the docs are over there, and the nurses and everything. We're trying to help people get healthy, and you folks are worried about, how much money we're making, and then your practices have been bought up. I could go on and on and on. The change in healthcare is amazing, but here's the deal. There is no blueprint. Here, I'll close it with this, Marjana. I was fortunate enough to be speaking for Aetna. Mark Bartolini was president of Aetna. And this was a few years back. And I was going to be talking about change. And I was going to be talking to their whole company in a closed circuit broadcast. And the night before is when the Affordable Care Act first passed. Talk about change. But I've learned from all my clients. I remember Mark getting up there saying, folks, as you know, this new law has been passed and none of us knows what it means. He had a good sense of humor. He says, number one, we got a just-in-time speaker. I got a guy here to talk to you about change. But he says, number two, the good news is, bad news is, we don't know how it's going to work out. The good news is we can have a say in making that future become a reality. So it's learning to think like that, learning to lead like that. I could go on and on and on, but those are just a few ideas.